You're listening to 1380 The Woman, St. Louis to 1380 The Woman, St. Louis's only all-woman talk radio station.
The Woman, I'm your host, Sonia Shin, and Kathy Bratkowski is hosting with me today, and we are here to talk about something and how that actually can be something that might be leading, might be a sign of something more serious. We have Dr. Cathy Naughton from the Incontinence. How are you doing?
Fine, thank you so much for having me.
Yeah, thanks so much for being on the show. So how common is inevitable as you get to a certain age for women and so forth, but I think it seems like it's more common than we realize.
Absolutely. Incontinence is actually 1 in 3 people will have some complaints of urgency, frequency, or bothersome symptoms. Now, prevalence of it is probably more common than we think because it's a very embarrassing condition. And so
1 in 3, that surprises me. How about you, Kathy?
It does surprise me too. Yeah, I mean, I know it is common among women, especially after childbirth. If it's that common.
Right. One of the big things to differentiate, though, in terms of leakage, is that there are 2 big flavors of leakage. One is the other sort of big flavor is the overactive bladder incontinence, which is described as urgency, frequency, concern, which you have, and some patients actually have a mixed picture. And because some of the treatments are good for both, but some...
You talked about 1 in 3 people have it. Does that vary a lot with age?
Right. It typically, because overactive bladder, combination of reasons, as you suggested, childbirth, the pelvic floor becomes weaker, more to keep in mind is it is also common in men as well.
Okay.
Yeah.
How common is it with men?
It's again to deal with, but again, probably a lot of urinary symptoms due to an enlarged prostate may actually be in fact.
I'd heard that if you have a bladder issue or have some bladder control issues, that it could actually be the sign of something more serious. Can you tell us about that?
A quality of life issue, leaking on yourself, but this can be a sign of other medical issues. These are what we call irritative voiding frequency, getting up at night. That could be because of a stone in the bladder, or commonly a bladder tumor. So, the message is...
Okay. Now, how often is it something besides, just incontinence?
Right. So again, you're going to find it in a certain percentage of your patient population, and in my mind, if you find one, that's...
So it may not just be... Well, what if somebody is concerned about, that copay might be expensive, or maybe they don't have insurance, and do beforehand, maybe do some Kegel exercises and see if that takes care of it, or... Right.
So again, depending on the type of leakage you have, exercises, in my mind, it's not enough to just sort of give you a piece of paper that says, here, practice your Kegel exercises. A lot of people do not. I have a program with physical therapy as part of the Incontinence Institute. There are also other physical therapists that provide, at least in the beginning, to know where the muscles are so that you know that you're doing the exercises correctly. Because frankly, you can hurt yourself by not doing them correctly. If you're contracting without the important part of the relaxation part, which is, what a lot of people tend to, if you do not relax the pelvic floor.
Oh, like what kind of other dysfunctions?
That can lead to constipation or painful intercourse. The bowel system and the sexual system is all connected in terms of the pelvis, so it does affect all those things.
This and kind of just, you kind of go along and maybe don't pay a lot of attention to it. How do you know when it's time to actually come to see someone like you?
Right. An incident where, it's embarrassing or you leak, and, this is enough. A lot of people start dealing with the bathroom mapping, decreasing your fluid intake, avoiding social situations where you're worried, which, again, this impact is to seek counsel immediately. Mm-hmm. Because, again, if nothing else, to rule out these other potentials going to affect your quality of life. So I would seek counsel, at least bring it up to at least your primary care provider, in which case they can refer you.
Are there certain things that, can make it worse, like caffeine or any dietary things?
You absolutely do. That's absolutely spicy foods. However, it's amazing how a lot of patients, they're very specific. So I have patients that say, individual, but food is one of the biggest activators of overactive bladder. It can exacerbate the symptoms. The other thing, stress, I find, is one of the other triggers. So anything you can do for relaxation, these things may help. And as once we rule out the badness, my philosophy is less invasive to most invasive. So if you don't need a medication or others.
Okay. Mm-hmm. Now we're speaking with Dr. Cathy Naughton from the Incontinence Institute about incontinence and bladder control and how that could be the sign of something bladder control issue could be actually pointing to.
Right. One of the most common things and simple things can be just a ordinary urinary tract. Symptoms of overactive bladder actually mimic infection. And so I have it both ways. I have a lot of patients that come in and say, I have urinary antibiotics over the phone because, you don't want to miss an infection. But in fact, their urine cultures come back negative. So it could be a urinary tract infection. Now, on the other hand, you could actually truly have an infection, which have the same symptoms. So if you have a true common, then there are other things that irritate the bladder, such as a bladder stone or bladder cancer.
Okay. And how often, how likely is it that a doctor is going to be able to catch, because like you just said, oftentimes women will think they have a urinary and they have an overactive, or they have, some bladder control issues and they go in. Is it likely that a doctor is going to be able to catch that it might be something completely?
Of the physician and what they do. In my office, we have checked urines on everyone. That's what we do. And give us a clue if you have an infection, but frankly, you have to send it away for an actual culture. It takes 2 to 3 days for those results to come back. So, again, you might have someone look inside your bladder, which is really the only way to diagnose bladder cancer. And so there are other procedures that we can do to try to rule these other important things out.
So, if somebody comes to you, like the urine thing is pretty, the urine test is pretty quick and easy, but like bladder cancer, does everyone get screened for bladder cancer, or is that only when things don't work?
And also depending on the patient's history as well as the patient's age. So in older patients, especially with or a look inside the bladder, then let's say an 18-year-old who notices her frequency is more when she has more cough, I would recommend having a look inside the bladder.
Okay, excellent.
So it sounds like you kind of screen people a little bit to go with the testing when they come see you.
That's the art of medicine.
Yeah, absolutely.
Right.
Now, we've been speaking with Dr. Last tips, any advice that you think people should know that maybe they just didn't even realize?
One of the deterrents of people, things we can do, there are behavioral therapies, physical therapies we can advise you on, medications, something called do Botox injections in the bladder. So, there's a whole litany of things that we can offer, and, between myself and the patient to figure out how much this is affecting their quality of life, and then we would proceed to there. So, and one of the first places you can look at is myconfidentlife.com, or you can call the Incontinence Institute at 1-800.
Okay. How soon should someone go in and see someone about this? Because I've heard about people who will maybe have, a bladder control issue for all.
Hotline immediately.
Yeah.
And find out, are there specific things that you haven't had ruled out? Have you had after I rule out anything bad, then, you don't have to do anything, but then you'd be surprised when treatments work. You have more control of your life. You're able to say yes to invitations to social outings and, go on long car trips. That you don't notice how much of an impact it's making in your life until you actually have an effective therapy.
Yeah.
And we do have
local, aren't you, in St. Louis?
Absolutely.
Located here?
Yes. I have an office, Center for Sexual Health, STL.com. That's part of my office. It's 314-315-9965. Or you can get us through the Incontinence.
Hey, Dr. Cathy Naughton, thanks so much for all this great information and all these great tips.
Oh, you're welcome. Thank you for having me.
Yeah, have a great afternoon.
Thank you.
Take care.
She always has to ask me this, and I do always learn something on the healthy beauty.
Me too. Good. We're going to come back and talk some more health and beauty news and have the healthy beauty question of the day coming up. That's all coming up on 1380 AM. Stay tuned. And also
The 1380 The Woman, St. Louis's only all-woman talk radio station.